Today we're going to be discussing cervicalgia. So I know that's a big funky word. So what does it really mean? What cervicalgia is neck pain. And not only just your everyday general neck pain, but associated pain such as pain in the upper back region and the shoulders, and sometimes traveling pain associated with that neck pain that may go down into your arm and even your hands and fingers. And it's important to know what kind of causes this type of pain. Why may you experience this type of pain? So in 2021, we have something we refer to as tech neck. Since we're always looking down at phones, tablets, computer screens, a lot of individuals have office jobs. Over time, having those posture imbalances and irregularities can really add up and put added stress on the neck, the head and neck region, causing this pain. There's other factors too, such as emotional and psychological stress that cause you to tense up, and that really builds up over time as well, adding pain into this neck, head, neck, and shoulder region. And also our daily habits such as posture irregularities, not having our body in proper alignment, that causes this pain as well, with the associated symptoms I talked about, the headaches, jaw pain, etc. I'd like to get a little bit into the anatomy of the neck region to help explain what sometimes can cause this neck pain. So I thought I'd draw a picture for you, and I'm no artist, but here we have the skull, and the neck isn't just one big bone. There are actually 7 bones depicted here that make up the neck region. And in between each of those is a small disc. And what that disc does is help add motion into the region. And your spinal cord runs right through here as well. So what I'm getting to is that because thankfully we do have motion in our neck, so we can do a lot of things in life, with that comes the possibility of a bone coming out of alignment. And that is where chiropractors can come in and perform what we call high velocity, low amplitude adjustments, which put these bones back in place to help relieve some of the tension that can be placed on the neck region and help you keep your body in proper alignment. And not only are there the bones and discs that I talked about, but a lot of muscles are in this region that connect to the 7 neck bones I talked about, as well as the skull. And a lot of times when we have those stresses that I previously discussed, it's important to look at the musculature in this area, as well as soft tissue such as ligaments and tendons, and try to find what is causing the pain and see if we can reduce the issues with, again, the soft tissue and muscles in there as well. So for that, what chiropractors can do is what we call soft tissue work, which will resemble what a massage is to release some of the tightness and tension in that region, as well as other things such as, based on how long you've been experiencing the neck pain, ice or heat to either reduce inflammation in the area if it's more recent, or if it's something you've been experiencing a very long time, applying heat to help reduce some of the tension that is built up over time in that area. And that's why it's important to come to a chiropractor or another trained and licensed healthcare professional to find maybe what the causes of this neck pain and what is the best form of treatment for you to help reduce the pain and other symptoms you are experiencing from this pain. I'd like to highlight some studies that are focused on chiropractors specifically treating patients with not only those short-term neck pain injuries, but those who have been experiencing neck pain for an extended period of time, or cervicalgia, our big fancy word. So one study is by Mitchell Haas et al., and it is titled Dose Response for Chiropractic Care of Chronic Cervicogenic Headaches and Associated Neck Pain, a randomized controlled trial. So these patients received 12 treatments of chiropractic care, including that soft tissue work and heat and ice that I previously talked about. And overall, the patients experienced a great reduction in not only their neck pain, but those associated symptoms I discussed, such as the headaches. I found very similar results in another study, but this was more for specifically short-term neck pain, and they received the adjustments as well as the soft tissue work I talked about. In this study, it was by Michael T. Hainline and Robert Cooperstein, titled Chiropractic Care for Patients with Acute Neck Pain. And what this study found, again, was that there was a great reduction of pain as well as those other symptoms with the application of the high velocity, low amplitude adjustments and the other treatments such as the soft tissue massage and heat and ice that we previously discussed. Neck pain is a very common occurrence, especially as I highlighted in today's world, and it's important to get into a licensed chiropractor to find what the cause of this neck pain is, so that ideally your body can be put in a position to reduce the tension on this area of the body, and that you can get back living a healthy and symptom-free lifestyle.